Do you frequently feel like your heart is racing for no reason? Or maybe you suddenly get very itchy after a mild insect bite, or even just a warm shower. Imagine your body's alarm system going off when there's no real danger. That's something people with systemic mastocytosis often experience. This disease is rare but powerful. It means too many mast cells, immune cells that usually help you fight allergies and infections, build up in your body, especially in the bone marrow, skin, and organs. Instead of protecting you, these extra cells cause repeated allergic-like explosions. For example, some people flush red, feel dizzy, or even pass out after drinking coffee or taking a hot bath. Real-life impact. Think of someone avoiding hugs because skin contact might trigger a reaction. That's the life of someone with this condition, always cautious, always listening to their body's strange warnings. What causes too many mast cells to grow? It's mostly due to a tiny mistake in your body's instruction manual, your genes. Specifically, a mutation in a gene called KIT, say KIT, tells your bone marrow, make more mast cells, lots more. And your body listens, even though it should. Now here's the interactive part. Think about a garden hose. Normally, the tap gives a steady flow of water, normal cell growth. But in this case, the tap is broken and stuck open. The gene mutation, so water mast cells, keeps flooding the garden. This mutation isn't usually passed from parents. It happens randomly, often later in life. So no, it's not caused by what you eat or stress, but by a cellular typo that quietly changes how your body works. Let's play a quick matching game. Which of these sounds like an allergic reaction? A. Sudden red face and sweating after eating spicy food. B. Stomach pain and diarrhea after milk. Or C. All of the above. If you picked C, great. But what if these happen and you're not even eating anything unusual? That's what happens in systemic mastocytosis. Common signs include flushing, face turning red and hot, itchy skin, bone pain, nausea, and even fainting. Some people get hives when scratched. Imagine writing your name on your arm with your finger and it turns into a red welt. Another example, a person takes an aspirin for a headache and suddenly feels like their heart is pounding. That's a mast cell flare. In severe cases, the organs like the liver or spleen swell. So, if your body overreacts to everyday things and medical tests don't explain why, this could be a possible clue. Diagnosing this disease is like solving a mystery. Doctors don't just check symptoms, they look for clues in your blood, bone marrow, and skin. A blood test might show high levels of tryptase, a chemical mast cells release. Think of tryptase as smoke. If there's too much smoke, there's probably a fire, too many mast cells. To confirm, a doctor may do a bone marrow biopsy, a small sample taken from the hip bone to check for extra mast cells. Skin biopsies help too, especially if rashes are present. Now for treatment, there's no cure, but we manage it. Antihistamines, like allergy meds, help daily. Epinephrine autoinjectors, like EpiPens, are carried in case of severe reactions. Imagine carrying a personal off switch for a sudden attack. Newer drugs target the KIT gene mutation. For flare-ups, avoiding triggers like alcohol, certain medications, or hot showers is key. It's like learning your body's danger zones and building a personal safety map. Can you prevent systemic mastocytosis? Since it's caused by random gene changes, you can't stop it from starting, just like you can't stop a lightning strike. But you can prevent severe reactions. Think of it like managing asthma. You can't prevent asthma, but you avoid smoke and cold air. Here, prevention means knowing your triggers. Keep a symptom diary. When did you feel dizzy? What did you eat? Did you exercise? One person might find that coffee is dangerous, while another is fine with it. Also, wear a medical ID bracelet that says mastocytosis. In an emergency, it could save your life. And always carry your EpiPen. Prevention here isn't about stopping the disease, but staying safe every day, like wearing a seatbelt, just in case. Science is making progress. Recently, researchers have developed new drugs called tyrosine kinase inhibitors. They're like special keys that lock the broken KIT gene's switch in the off position. One drug, avapritinib, has shown success in reducing tumor-like mast cell buildups and improving quality of life. Imagine a future where the hose tap not only gets fixed, but learns to self-regulate. Also, clinical trials are testing gene therapies and immune-targeting treatments. Another exciting advance: better diagnostic tools using genetic screening to catch the disease earlier. For patients, this means hope for fewer symptoms and more normal days. You could be one blood test away from a treatment that didn't exist 5 years ago, and that's real progress.